For more on the drop in COVID cases and Hawaii's Safe Travels program, let's get right to it with the Lieutenant Governor and the state's COVID-19 liaison, Dr. Josh Green. Good morning, Doc. How are you doing this morning?
Doing great. Good morning.
Now, first off, what's your reaction to the big news yesterday of bribery allegations against former lawmakers Kalani English and Ty Cullen?
My reaction is we need leaders that we can trust and who care about people. That's what we have to have in our government. That's my reaction.
How do you say to people out there, and how do we get local politicians to regain the public's trust?
They'll have to lead by example. People will have to kind of double down on doing the right things. And there are a lot of good legislators, and I guess there are some bad ones. And so, again, we just need people we can trust and who really demonstrate that they care. And that's what people should look for in candidates.
Now, turning to COVID, the state reported 533 cases yesterday, the lowest number that we've seen in 2 months. Is this it? Because a lot of callers are saying they can't handle any more restrictions.
This is the beginning of the end, at least for this phase of the pandemic, and it's a very good, group of news. 533 cases. More importantly, we're down 19,000 to 19,000 active cases. That's 66% below our peak. Our hospital number is 48.7% below our peak, so we're in a very good space. We've boosted 515,000 people, so we're coming out of it. And I would look to see these restrictions that remain begin to go away. We are really coming to the right place. People should still be smart, but we've come through the worst of it.
Now, the governor announced yesterday that a booster mandate will not be added to Hawaii's Safe Travels program. What happens to the program now?
The program eventually goes away. The program is still in place. What he announced was we're not going to make any changes, so there's no more confusion for travelers, so we don't have to adjust again internally. But as our cases drop, and I'll be making this recommendation in the coming days, as our cases drop to a place where our hospitalizations are below 100 consistently, that's the point at which we should really, I think, seriously look at removing all restrictions. You will see across the country they've begun to remove all restrictions like mask wearing, gathering restrictions, restrictions on travel. We should get there too, but we want to be safe and smart. We're going to give a really good recommendation to the governor so he can make that determination. I would say sometime between the end of March and early April.
What's the probability of removing the mask mandate? Because that's one of those things where a lot of people have been calling in, posting to our Facebook questions, asking when is the mask mandate going to be removed?
I'd say it's highly likely. First, I think we would probably sunset the Safe Travels program because we would be at a place where we have such low case counts, we don't need it. But then the last thing would be mask wearing indoors, especially among people who are not protected, who don't have vaccination status done, or who have immune compromised. That's the last thing that should be removed. But again, if other states are doing it and we are better than every other state except for Vermont, is my understanding, as far as case counts go, we ought to also be in a place that we can join the rest of the world and begin to reduce restrictions. So I think, again, that's going to be early April at the latest, but we have to, we have to respect the fact that Governor Ige will make that call.
And we also got a couple of Facebook questions asking, okay, is this it? Because we had the Delta and we thought it was it, and then all of a sudden Omicron pops up. What's the possibility of the next variant, which would be Pi, I believe, that would show up?
Well, the probability decreases each time that any kind of variant is going to be severe, because you just have to look at how much immunity we have. 75.2% of all of our people are fully vaccinated, meaning they've had 2 shots. Another 36% of our population has actually gotten a booster already, and many people caught Omicron. Hundreds of thousands of people caught Omicron in the last 3 months, and that means they also have immunity, natural immunity to this variant. So each subsequent strain will be less impactful and less risky for us. Not without any risk. There is going to be coronavirus or COVID around in the coming years, but now states like ours are going to be very well protected, and we have to move on with our lives. So we'll be able to give healthcare guidance, which will probably be when we have surges, you wear a mask. It will not be a law, it will not be a mandate, but it will likely be just good health recommendations. And we'll continue to recommend the best science on getting boosters. But I think we are beginning to see the end of the COVID response, at least the acute COVID response. And I think that should make people very happy because we have to come into this year and kind of renew our lives. And I think that's where most people are.
All right, there you have it, the Lieutenant Governor, Dr. Josh Green. Thank you, as always, for your time and insight, and have a great day.
You too. Thank you very much. Take care.